particular topic comes up frequently in our practice. We see quite a few young women coming in, and also sometimes it's the moms who ask questions about their daughters, particularly if they already have hair issues. How is pregnancy going to affect them? We thought this would be a worthwhile presentation. And as I said, it is a busy time, so maybe a lot of people couldn't sign on, but the webinar will be on our website, so that if you know anybody who missed it, who might be interested in the information, just direct them to our website. The webinar will be there. They can watch it at their convenience, as with all the other webinars that are there. There's quite a few topics. We do encourage people to watch. So I'm going to go ahead and start. Again, our topics are hormones, pregnancy, and hair loss. Again, thank you for joining us this evening. We'll go ahead and start. For those of you who don't know me, my name is Dr. Mary Wendel. I am the National Medical Director for Medi, Tresse. We specialize just in female hair loss, all the different causes of hair loss. And so this is a subject, hair loss after and during pregnancy is something that interests me a great deal. When I had my first child, I wasn't the least bit knowledgeable about hair loss, particularly surrounding pregnancy. And so when my hair started to shed, I had no idea why it was happening, and it was really a friend of mine who was a nurse who noticed the hair in my sink and said, "Oh, you're shedding too." She had just had a baby and she was shedding, and I'm like, "Yeah, but I didn't understand why." And she was a nurse and she knew and I did not. So it was a topic that I obviously could have learned a bit more about. I certainly know a lot more about it now. In any case, these are the topics we'll talk about. I'm going to give a brief introduction about female hair loss that will help you understand a little bit about what I'm talking about later on. I'll specifically talk about what happens to the hormones during pregnancy. Also, we'll talk about other causes of hair loss or changes in hair growth related to pregnancy, but not necessarily hormonally driven. We'll talk a little bit about treatments, because there are some things that you can do to decrease the likelihood of shedding. And then oftentimes afterwards, what can be done to limit the amount of hair loss. And part of that discussion will be a brief discussion about postpartum birth control, which can also affect hair growth. We'll have a question and answer section at the end. So let's dig in. A little bit of background. We'll talk about the hair life cycle. It is quite pertinent to the hair shedding that's particularly common with pregnancy. And also common with any kind of hormonal changes. There's 3 stages, actually 4, but the 3 main stages of hair growth involve the anagen, which is the growth phase, and that can last 2 to 6 years, and actually in young children it can be even longer. That's why little girls can grow their hair so long and I cannot. It changes with age. The catagen stage is, I'm actually going to make myself disappear during the video, so I'll come back at the end. The catagen phase is the sort of resting phase. It's a transition phase between growth and then loss. And then the final phase is the telogen, which is classically the resting phase, but in fact, it's preparing for the hair to be shed. And this telogen phase can last for several months. Even once the hair falls out, there tends to be a resting phase where the hair does not regrow right away. There are risk factors associated with hair loss related to pregnancy, but also related to other issues. Genetics can play a role. If you have a family history of shedding, it's more likely to happen to you as well. Stress plays a huge role. We've seen that in the last 2 years, but I will also tell you that stress during pregnancy and after, I believe, plays a big role in excessive shedding and hair loss. Poor nutrition, again, can't emphasize that enough. Before pregnancy, during and after, good nutrition is absolutely essential for good hair growth. We see a lot of women with nutritional deficiencies who are experiencing hair loss or poor quality of hair. Illness can play a role. Clearly, we're not talking about that today. Hormonal imbalances, that is what happens. It's not so much an imbalance as it is a change during pregnancy, both in the early phases and then after pregnancy. The changes that take place put your hair at risk. Age and scalp and follicle health, again, the older you are, the more likely this is to happen. And again, underlying scalp and follicle health can predispose you to hair loss at any age, but also especially during and after pregnancy. Okay, so just briefly, the non-scarring types of hair loss, which is alopecia. Androgenic alopecia is the most common. It's female pattern hair loss, and that can get aggravated, and we'll talk about that during pregnancy. Telogen effluvium is the term utilized for excessive shedding, and that's what most women experience with pregnancy and after. But even other types of hair loss like alopecia areata and post-cancer hair loss can be made worse after pregnancy and due to the hormonal changes that can take place. Scarring alopecia, not so much. That tends to occur with older women. Okay, this is an important first step no matter what your causes of hair loss, whether it's related to hormones, pregnancy, or nutrition, whatever the cause. The first step is actually to get a thorough evaluation because the treatment varies significantly. The history is important, the medical history, even the family history, doing a complete examination with trichoscopy, which is the microscope, which we can look at the scalp and really get a good idea as to what's going on with your hair follicles. Sometimes we do blood work and a biopsy. That would not necessarily be needed with hair loss related to pregnancy. But again, treatment can vary significantly. And even following pregnancy, there are so many things that can be playing a role besides the hormones that sometimes checking nutritional levels, vitamin levels might be indicated. Okay. The section of hormones and pregnancy is a little deceiving because this particular chart has nothing to do with pregnancy, but I just wanted you to get an idea of the variabilities of hormone levels throughout life. The bottom, you can see the ages, and the round circles, the empty circles are your estrogen levels, which vary during your life. The top line is actually testosterone, and we do know that testosterone has a negative effect on hair. So as we lose our estrogen, the testosterone can actually have a profound effect on hair loss. And with those changes that can occur with menopause, with pregnancy, throughout life, it can affect our hair growth. And the testosterone can have a greater effect negatively on our hair if our estrogen levels start to fall. So this is what happens during pregnancy. And the pink or the red one is the HCG, which is the hormone that they actually test to determine if you're pregnant. But the estrogen is the top line. It's spelled with O because this is a British, this came from a British journal, and they spell estrogen with an O, and progesterone. So you can see that the estrogen and progesterone levels just skyrocket during pregnancy. And that's one of the main reasons why hair is happy during pregnancy most of the time. But again, there are other hormones that are increased during pregnancy, but those are the two main ones we're going to talk about. So just to give you a comparison, so for the healthy premenopausal woman, the estrogen or the estradiol levels range between 30 and 400 nanograms. And again, that varies from month to month because that does change with your period. Postmenopausally, you can see that it drops, and that's what that first graph did show, that the levels do fall significantly. And that's why we see a lot of women here at the office who are postmenopausal and experiencing hair loss. But look at what happens during pregnancy. That is a huge increase in the amount of estradiol. It's just a dramatic increase. And we believe that the increase in estrogen as well as progesterone accounts for the thickness that can occur during pregnancy. So again, most women have thicker and healthier hair during pregnancy, and the estradiol is one of those reasons. Just a little unrelated. So again, we do know that when estrogen levels fall, hair loss can be aggravated during menopause. But again, during pregnancy, it's the opposite. The estrogen, the progesterone increase. And so we do feel that those hormones are in a greater balance during pregnancy and can account for thicker hair. So what do these hormones actually do? And we'll talk about during, after, and postpartum. Again, so here's our life cycle. And during pregnancy, those increase in hormones actually increase the anagen rate, which is again that growth rate. So you actually, more of the hairs are in anagen and producing thicker, better quality hair. the hair follicles remain there longer, allowing the hair to not only get thicker, but to grow for a longer period of time. So that's what's happening during pregnancies. Those hormones are having a positive effect on the rate of hair growth, and the thickness and the quality of hair tends to improve. Rarely do we see women whose hair actually gets thinner, although I have seen it. And usually there are some other underlying issues that may be playing a role here. And sometimes we do need to address those as well. But the vast majority of women, even women who have thinning hair prior to pregnancy, will find that during pregnancy, their hair is much thicker and healthier. So after childbirth, after the delivery of the baby and after the placenta gets released, the hormones drop, and they don't drop slowly, they drop rapidly. And so what happens then is those anagen or growth phase decreases, and the telogen, which is the hair falling out phase, increases. And that's what causes the shedding. The official term is a telogen effluvium. So the next slide, I believe, will show just how rapidly that happens. So you can see here, okay, so the estrogen, the progesterone drop precipitously in a very short period of time. It seems crazy that this is what our body does, but it's what it does. And so these hormonal changes are the most common cause for hair loss that's related to pregnancy. But it's a very rapid change. It happens within the first few weeks of after childbirth. It's a bit of shock. It's a bit of a shock not only for our hair, but for other parts of our body as well. So in the postpartum phase, the post-delivery phase, this leads to increased shedding. That telogen phase takes over. And typically, prior to a shedding phase, actually prior to pregnancy, about 90% of your hairs are in the growth phase, that anagen phase, and about 10% should be in the telogen phase. Postpartum, those numbers can change dramatically. The telogen phase can represent 20 to 25% of the hairs being in the shedding phase. So that can be a sudden significant increase in the amount of hair that you see. You have hundreds of thousands of hairs, but suddenly 10 to 15% of them, more than usual, are shedding. And it can be quite dramatic. Now, the shedding phase can last around, it occurs at about the 3rd to 4th month postpartum. I know my first child was born in June. By about September, my hair was everywhere. But generally, the shedding lasts about 3 months. It can last up to 6, but typically more around 3 to 4. And then the hair will regrow back to where it was prior to pregnancy. It won't go back to that pregnancy level of hair growth, but it will go back to the pre-pregnancy rate. So what are the statistics? About 30 to 50% of women will experience a telogen effluvium. And again, that's a fair number of women, but not everybody experiences it to the same degree. You know, it's really the women who have that higher level of shedding that are going to notice it or call their doctor or be like me and just wonder what is going on, until a good friend who knew better could tell me. The good news is, again, most of those women who have significant shedding, it will stop. Your hormone levels tend to equilibrate. It takes a few months for that to happen. We all know who've had babies that it takes a while for our bodies to recover. And if you're nursing, there are other hormones like prolactin, which increase and have other benefits. Not that they stop the shedding completely, but it does seem to be slightly protective. So what other things can cause hair loss related to pregnancy other than hormones? And I've listed a few here. It's probably not totally complete, but it's the most common ones, and we'll talk about each of them separately: nutrition, stress, changes in immunity, which is an interesting and kind of complicated topic I'll just briefly touch on. And then the issue of aggravating underlying hair loss from other causes, because a lot of women will come here pretty young, having genetic or androgenic alopecia, family pattern hair loss, looking to get pregnant, and what can they expect in terms of their hair loss? So nutrition, this is such an important topic, not just during pregnancy, but throughout life, for many, many reasons of our health. But here, focusing on hair, I can't tell you how important good nutrition is for healthy hair, whether you're pregnant or not. But nutrition is incredibly important during pregnancy because so much of the nutrition goes to the baby and a lot gets left out to the mom. So you've got to make up for that. This is sort of some recommendations from Johns Hopkins University. They talk about appropriate weight gain, a well-balanced diet, a good nutritional diet, regular exercise, and important pieces of vitamin and a mineral supplement. These are all also important postpartum, with the exception of weight gain. Clearly, the weight will come down. Poor quality nutrition is one of the most common causes of poor hair growth and shedding at all times of a woman's life. So even without the hormonal changes, if your nutrition is poor, you're at greater likelihood of shedding. The nutritional demands are very high during pregnancy, and they continue throughout breastfeeding if you do breastfeed. For one child, you need an additional 350 calories a day during pregnancy. With twins, it goes up to 700 to 800 calories a day. The recommendation is for a balanced whole food diet, less processed food. That goes across the board even without being pregnant. We find that the diet in this country is so poorly nutritious that we see very bad quality here across the board. But being pregnant, that nutrition goes to the baby and you need to supplement yourself very carefully. We do recommend low-fat dairy if possible, again, because we want to limit weight gain. We don't want excessive weight gain. And then you need to increase your protein to 70 grams a day. Again, this comes from Johns Hopkins University. Typically, a woman who's not pregnant or breastfeeding needs about 50 grams of protein a day. So that's a significant increase in the amount of protein that is needed for good nutrition for you and for the baby, and then postpartum. Supplements. Usually, OBGYN doctors utilize prenatal vitamins with iron. Very important that all women who are pregnant take their supplements, whether they're concerned about their hair or not. Calcium, so important for the baby's bones and tissues. Vitamin D, iron is incredibly important, especially it's important for the baby, but also for mom, because pregnant women tend to be a little anemic, and then postpartum, virtually everybody's anemic. And so the iron is important to boost your strength. Low iron levels are a very common cause of hair loss in both non-pregnant and pregnant women. Folic acid, it's a B vitamin, very important for pregnant women because of neural tube defects. And then omega-3 fatty acids, vitamin A, iodine, B6, B12, all important. These are all in your prenatal vitamins. Deficiencies in vitamin D and iron and protein have all been shown clinically in studies to aggravate shedding, that's the telogen effluvium, as well as alopecia areata, which is really interesting. Again, these were noted in clinical studies. Now, this can occur during pregnancy as well. If you don't have the proper nutrition, you're much more likely to have issues with these hair issues during pregnancy and after. So stress, one of my favorite topics. Clearly, we're not going to talk a great deal about it, but stress is one of the most common causes of excessive shedding and telogen effluvium, even unrelated to pregnancy. But as anybody who's had a baby knows, the postpartum period, even during pregnancy, incredibly stressful, incredibly stressful. Some of the worst shedding that I've ever seen in this practice, unrelated to pregnancy, have been as a result of stress. So we know that stress is very common during pregnancy and then after. So I've listed that, the postpartum timeframe, increased stress. Sleep deprivation, again, causes more stress. You have elevated cortisol levels. There can be postpartum depression, sometimes severe enough to require meds, and sometimes the meds themselves can interfere with some hair loss. So again, all of these things can play a role in creating more difficulty in maintaining hair and more likely to develop excessive shedding in the postpartum period. Interestingly, I looked up a little bit about sleep deprivation, because sleep deprivation is pretty much everybody experiences sleep deprivation after the birth of a child. And physiologically, it can cause an increase in the inflammatory markers in our bodies, increase cortisol levels. Both of those things can lead to increased shedding and it can increase a telogen effluvium. So if you're already more likely to shed postpartum because of the hormonal changes, and then you throw on the sleep deprivation and the inflammatory situation that your body is in, it's more likely to aggravate that telogen effluvium further. So changes in immune status, which is kind of a particularly interesting topic, but I'm just going to speak on it briefly. The expectant mother's immune system actually has to adjust to prevent her body from rejecting the fetus. Babies are actually foreign substances in a woman's body. Only half of the baby's bodies come from the mother, and so the rest of it is a foreign material. And so during pregnancy, the mom actually has to diminish some of her inflammatory reactions. The dominant hormone, one of the dominant hormones is progesterone as well as the estrogen, but progesterone is known to decrease the maternal immune response. So in the first 12 weeks of pregnancy, there tends to be more inflammation. The later weeks, it tends to decrease and anti-inflammation tends to prevail. The significance of that is uncertain. There needs to be a lot more research done on this. But why is this important? Why have I mentioned this? And the reason is that some women who have autoimmune disorders before pregnancy notice that their hair can change during pregnancy. So when I'm talking about autoimmune disorders, what am I referring to? Well, alopecia areata, which is bald spots that can congeal and then have very large loss of hair of the scalp and the eyebrows as well as eyelashes. Alopecia areata growth can actually improve during pregnancy, and we've seen that with a few of our patients. Without treatment, it seems to improve. Rheumatoid arthritis, a well-known autoimmune disorder. Interestingly enough, hair growth can improve. It's not really clear why that is. Lupus, SLE, systemic lupus erythematosus, is a very strong autoimmune disorder, can be very serious, and often hair loss does worsen. And unfortunately, these patients need to be monitored really carefully. And unfortunately, some of the medications that they still have to maintain during pregnancy can make their hair loss worse, which is unfortunate. Thyroid disorders, which actually are autoimmune disorders like Hashimoto's thyroiditis, Graves' disease, can be autoimmune diseases. They can become imbalanced during pregnancy. They need to be monitored very carefully. And so if the thyroid function is out of balance, you can get resulting in increased hair loss, both during pregnancy and after. The last category, scarring alopecia. We see a lot of scarring alopecia in this practice, but I could find no studies discussing hair loss related to pregnancy. And probably the reason for that is typically this entity occurs in mostly women who are over 40 and beyond their childbearing years. I want to talk a little bit about androgenic alopecia or female pattern hair loss, because that's the most common type of hair loss that we see, and we see a lot in young women, particularly like PCOS patients or women who have a strong family history of hair loss, and they may have noticed that it's beginning to thin even in their early to mid 30s. So with women who have a known prior history of androgenic alopecia, they are at slightly increased risk of a postpartum shedding, a postpartum TE. And part of that reason, I think, is that virtually all of the treatments that we use for androgenic alopecia have to be discontinued during pregnancy. Minoxidil, whether topical or oral, cannot be taken during pregnancy. We cannot do PRP treatments. And obviously birth control has to be discontinued in order to get pregnant. And a lot of those birth control pills actually are helpful for hair. So to stop them sort of puts you a little bit behind even before getting pregnant. A lot of times that will improve during pregnancy, that you'll get that offset regrowth during pregnancy. But again, having androgenic alopecia does make you at greater risk for postpartum telogen effluvium and excessive shedding. So what can we do to help diminish the hair loss related to pregnancy? And we'll divide that between before pregnancy, during, and after. And we'll talk a little bit about postpartum birth control. So before pregnancy, if a woman has a previous history of hair issues or hair loss, I think it's important for them to reach out to their consultant, their hair loss doctor, and discuss a plan. And we see this. We do see quite a few young women who have androgenic alopecia, who have alopecia areata, who already have experienced an episode of telogen effluvium, or have a chronic shedding, or some hair loss related to some previous chemotherapy. It's important to have those discussions. So when is it safe to stop those treatments? What can be used during pregnancy? Is there anything that can be used during pregnancy to help maintain hair? What are the recommendations for hair care? What should you do? What should you not do? And then the issue about when to restart birth control after pregnancy and what works best for hair at that time. So during pregnancy, so be diligent about your nutrition. Again, we talked a little about that. I can't stress it enough. The diet in this country, and it has more to do with, well, it's twofold. One is that the food that we purchase actually doesn't have the same nutritional value that it used to. Unfortunately, the nutrients in the soil have been really drained and overutilized. And so the foods themselves don't have as much nutrients. And then a lot of the food is overly processed and the nutrients are removed from it. Even before it gets on our plate, it is already deficient in so many nutrients. So during pregnancy, when your nutritional needs are so important for you and the baby, be diligent about it, be careful, take your supplements, make sure your diet is good, make sure you get all that protein that you need. So important. Hair is made from protein. You need to give it the protein it needs to grow. Now, what about styling? I think it's important, even though your hair may be thicker during pregnancy, to be gentle with it, because you don't know what's going to happen afterwards when those hormones go away. You want to avoid any kind of pulling, any kind of traction. Try to limit tight braids, pulling hairstyles, tight buns. Avoid the harsh chemical treatments. Avoid the chemical perms or straighteners. Let your hair be as natural as possible during pregnancy so that it can be as healthy and as strong as it can be during that time frame. Sort of giving it a head start before those hormonal changes take place. One thing that is safe during pregnancy that you can maintain is laser therapy, low-level laser therapy. And a lot of our patients are already on it as they head into pregnancy. And it is very safe during pregnancy and can be continued, which is great because it is also a stimulator of hair growth. It prolongs that growth cycle, that anagen phase that we talked about, and it allows you to grow a better quality hair. So what about after pregnancy? Again, don't stop those supplements. A lot of women will continue with their prenatal vitamins, which is fine. We do also have other supplements that we can recommend for women postpartum that might be a little bit more complete in terms of nutrients after pregnancy. Continue to be faithful to those dietary recommendations, particularly if you're nursing. Again, you need the protein, you need all those nutrients, you need all the vitamins. The truth of the matter is we're stressed after childbirth. We don't have a lot of time. We don't take good enough care of ourselves. So many things are playing into this. Women are pretty much always anemic immediately postpartum. Nobody really talks about it because it's just accepted. But in fact, I do think it probably plays a role in some of the shedding that takes place. It's important to continue to take that iron for at least 3 months postpartum to help build up that blood level, build up the iron level a little bit faster. And that's the time frame when the shedding hasn't started yet, is those first 3 months. Usually it takes about 3 months. So give yourself those 3 months of the supplements with iron. And if your supplement doesn't have iron in it, take a little bit. You only need like 1 over-the-counter dose of iron a day. This next suggestion is a bit wishful thinking. Try to get enough rest. If you can, find that time in your day to get rest, it goes a long way to help your body heal. If you have a laser and you've been using it pre-pregnancy and during pregnancy, continue to use it. Postpartum is not the time to stop your laser. You don't want to run the risk of aggravating any further shedding because you were so stressed, you forgot about your laser, it's sitting underneath your bed, whatever. Continue to use it. Try to be as faithful as possible. If you're not nursing, we can restart the other treatments for androgenic or female pattern hair loss if it's appropriate and you have that diagnosis. So just a brief discussion about postpartum birth control. Clearly, this is a discussion that women need to have with their OBGYN or their primary care physician. But I just want to give you a little bit of heads up in terms of hair loss and the different hormone components which can affect hair. As I said, within 3 months, that's when the shedding can start. And usually women start thinking about getting back on birth control pretty soon after childbirth. If you're on a birth control pill, you want to make sure it's an anti-androgenic one. And I've listed some. Your gynecologist will know what we're talking about when we say low androgenic birth control. That's all you have to say, and they know. They're very familiar with this chart that's on the right. It's just important. I always let my patients know it's important to just have that discussion. Let your doctor know you're worried about your hair. You want a low androgenic birth control. They'll know exactly what you're talking about. The other issue is IUDs. Most IUDs have hormones in them now. They use levonorgestrel, which is actually a highly androgenic form of birth control, and unfortunately can aggravate shedding, even in women who have not been pregnant. It's unfortunate that that's the case. Some women who never had a problem with shedding, they have the IUD put in, and then within 3 months, they're starting to shed. And the only thing you can do is remove it. So if shedding is a problem for you, if you have a history of excessive shedding, a history of female pattern hair loss or androgenic alopecia, if you have a history of other forms of hair loss, I would not recommend a hormone IUD. They come in different doses, and a lot of the gynecologists will say, well, just use the lower one. And I would say for most women, that's probably okay. But if you have this type of hair loss, I would not recommend it. So again, that's the bottom part. If the hair loss is progressive, which it can be, a woman slides into a chronic telogen effluvium, a chronic shedding. If she has a family history of hair loss, has noted some slow changes even prior to pregnancy, you really need to pay attention to the different forms of birth control that is available to you. Again, it's a discussion you can have with your gynecologist. We give out this information and just encourage our patients to go and educate themselves and have that discussion. Okay, a few of the takeaways here. The truth is that very few women actually lose their hair during pregnancy. It's very interesting that I have that there because it is true, but one of our managers here in the office today, who was in her first trimester, just talked to me today about the fact that she's noticing that she's shedding a little bit more. And it has been reported, and again, it oftentimes is due to some fluctuations in hormones early on, but most likely it will stabilize and the hair should thicken as the pregnancy continues. As you saw on that chart, by the middle of the pregnancy, those estrogen levels are thousands times higher than what they were pre-pregnancy. 30 to 50% of women will experience a shedding telogen effluvium after pregnancy. Most of it will resolve in 3 to 6 months, and fortunately, most women will get complete growth. Are there women who may find that they don't? Yes, but it's a small percentage, and it's usually women who have had previous histories of hair issues, whether it's androgenic alopecia, alopecia areata, previous chemotherapy hair loss, telogen effluvium. Those diagnoses tell us that your hair is under stress even before pregnancy. So you are at increased risk of shedding, and you're also at increased risk of maybe not completely recovering from that shed. In other words, not getting back to you where you were before pregnancy. So it's important, if you have those types of issues pre-pregnancy, to have that discussion with your hair consultant and make sure you're doing everything you possibly can to decrease that risk even before getting pregnant. What you need to do, have a plan in place, and keep it going during pregnancy and after. This is a wonderful time in a woman's life, but it is stressful. Your body goes through the most incredible changes in a very short period of time. That sudden drop in the hormones in the first few weeks after pregnancy are responsible for huge physiologic changes in our bodies, not just to hair. It's one of the reasons why emotionally you just feel like you're crashing and burning. And again, it takes time and they will stabilize, but those rapid changes in hormones do affect us in many, many ways, and hairs is one of them. So I got a fair amount of information in a short period of time. I'm going to try and put myself back on here. I actually don't see any questions here. If anybody has any questions, I'd be happy to answer them at this time. No? Okay, we must have covered everything to your satisfaction, and I'm happy to see that. If you, later on, you think about something that you should have spoken about earlier, you can contact us at on our email address at info@meditresse.com, and we'll certainly get back to you. And again, if you have any concerns that you want specifically addressed to you, just send them along and we will get back to you. I will answer them. Oh, there, somebody has a question. Let me get that one. When is it safe to resume PRP after having a baby? I would say that honestly, I would not probably recommend it if you were nursing, but if you were getting PRP treatments prior to pregnancy and are due for a booster, I probably would wait about 3 months. Get through that 3-month time frame when your body's hormones are beginning to equilibrate. And if you've been getting PRP, it's probably because you have androgenic alopecia. If you're not nursing, you can get starting on the minoxidil right away. You can intensify and broaden your supplements again. But in terms of PRP, I would probably wait the 3 months just to see if shedding is going to start. We generally don't do PRP if somebody is actively shedding. We tend to wait until the shedding quiets down. So I'd probably wait 3 to 4 months just to make sure that the shedding doesn't start. Anybody, any other questions? Okay, well, thank you all for joining us. Well, I'm probably going to take a couple months break of webinars, and then we'll start up again probably just around the beginning of September. Please let us know if there are topics that you are interested in. We are always looking at new treatments. I had done, I think my last webinar, I had spoken about all the new research that's being done and new treatments. And one of the things I did mention was the PDO threads, which is a way of amplifying PRP to stimulate hair regrowth. We are now starting PDO threads here. So if you're interested in having any questions about it, please give us a call or email us again at info@meditresse.com. If you're interested and want more information. I think that's all I have to offer for tonight. Again, thank you. We will start again in the fall, early September. And if you have specific topics you'd like addressed, please let us know and we'll look into that. All our other webinars are available on our website. And some of the information that I talked about today was from a previous webinar I did on hormones that was unrelated to pregnancy. So again, if you're interested in that, you will get some more information from that webinar as well. So thank you for joining us. Everybody have a great summer. I look forward to seeing you in a couple months. Take care.